Have you ever suffered from disease? Have you ever undergo in a certain operation? Or do you know a place where we can assess our health condition? Well, for this day, we're going to discuss and we will help you to find a place for you to be able to access a healthcare facilities. So once we said healthcare facilities, it discuss these questions. It tackles these three questions and it caters into the health condition of a certain individual. So what do we mean by healthcare facilities? Healthcare facilities. These are the places or institution that offers health services. This place helps the patients to cure his or her disease with the help of different health professionals like doctors, nurses, radiologists, etc. So according to the definition, this place offers services. These services are different procedure like CBC or complete blood count, X-ray, urinalysis, fecalysis, etc. So this place also offers checkups which I mentioned a while ago, yung mga example na minention ko, those are the different kinds of checkups and health services. The main purpose of these checkups is to monitor the health condition of the patient. So therefore, to sum it up, this is the place where we can monitor and assess our health condition. And what are the different examples of healthcare services? Actually, we do have four types of healthcare facilities. And those are the hospitals, which is the most common one. The second one is walk-in surgery center. The third one serves as the health center, and the last will be the extended healthcare facilities. So without further ado, let's compare and contrast these four of the types ng healthcare facilities. A hospital can be identified depending on how it is governed or kung papaano ipinapalakad ito. In governing hospitals, we have different standards and setting. This can be vary or pwedeng magkaiba-iba to based on how the facility is managed and how it is controlled. So therefore, since it's a company, meron dapat namumuno dito at yon ay nakadepende kung papaano papalakarin yung hospitals. So let's have the three kinds of hospitals. The first kind of hospitals is what we call private hospitals. These are the hospitals that generated to gain profit. Once we said profit, this is what we call yung kita ng isang hospital. So meaning this kind of hospital designed to become a business in helping the patients. Privately owned hospitals are funded and operated by the owner, which is typically a group of individual or person. So dito papasok yung mga investments and other stocks na maglalaan ng puhunan to gain or to have a certain hospital. The owner of the facility will be in charge of setting the budget, managing finances, and ensuring compliances with the strict municipal code, state law, and federal regulation. So therefore, since they spend money to build this kind of hospitals, yung money na yon, kikita yon once na may nag-admit or once na may pumasok na pasyente into that hospitals. Because the patient should pay for the different kinds of services na inavail niya doon sa hospitals na yon. And once na kumita yung pera nila into that private hospitals, yung kita na yon, that will serve as the profit for the hospitals and it will be divided into the businessman or into the stockholders or into the doctors or that was invested into the hospitals. So that is what we call private hospitals. So since they have the capital, they have the money, most of the equipments in private hospitals are more advanced compared to those hospitals. So medyo, yun nga lang, since advanced sila, mas mahal din yung babayaran in terms of private hospitals. Now, let's continue with the voluntary hospitals. Voluntary hospitals is also a private, but the difference between the two is voluntary hospitals are owned by the community, or sometimes it is not designed to gain profit. Yun yung pinagkaiba nung dalawa. Both of them is a private, but then again, the voluntary was not designed to gain profit. So voluntary, there is a partnership or corporation that handles this kind of hospital. In this kind of hospital also, the health services are free. Again, the health services are free, meaning as a patient, you will not spend money just to be treated. Sir, pwede ba yun? Walang bayad? Yes, it is possible. Actually, there are lots of voluntary hospitals out there. So dito papasok yung iba't ibang programs like free dental check-up, free vaccine, free health services, libreng tule, libreng check-up, so on and so forth. Kaya nga siya tinawag na voluntary because that is free. So minsan, dito din papasok yung mga libreng bakuna, so on and so forth. So that is voluntary. And last but not the least is the government or public hospital, which is the most common one. These are the hospitals that's run by the state or the government. Meaning, gobyerno ang nagpapalakad nito. This is any hospitals that's said to be governed publicly and is fully funded by the government and operates solely of money that is collected from taxpayers to fund health initiatives. Since not all of us can afford private hospitals, hindi sumusuko ang gobyerno para magkaroon tayo ng dekalidad na serbisyo in terms of health services. In these public or government hospitals, we can have various services na mas mura compare into the private hospitals. Eh sir, saan kinukuha yung budget for the government hospitals? Actually, the government get the budget from the taxpayers and collections. So therefore, the government spends money to address the needs of the people who cannot avail private hospitals. If we will compare the facilities of the three hospitals, we can say that private hospitals have equipment to operate different procedures, but it doesn't mean na hindi din kaya ng public hospitals yung ginagawa ng private hospitals. So again, that are the different kinds of hospitals. We are done discussing the different kinds of hospitals. And now, let's focus our discussion on how we will classify the hospitals. Actually, we can classify hospitals based on the services that they offer. There are two classifications of hospitals, which serve as the general and the specialty hospitals. So what is the difference of these hospitals? Once we said general hospitals, these are the hospitals which have a complete medical, surgical, and maternal care facilities. Meaning, they cater and treat different kinds of diseases, variety of diseases. They also have complete medical equipment in different kinds of diseases. They have different laboratories for operation, medical, mental, psychological, and maternal. On the other hand, the specialty hospitals are the hospitals that handle a particular disease or condition or deal with only one type of disease, meaning they focuses into the parts of the body or a specific disease. Example is nakafocus sila sa mga sakit sa puso. Doon lang sila nakafocus. So that is specialty hospitals. Or they only focus into different disease in lungs like pneumonia, tuberculosis, lung cancer, and that is what we call specialty hospital. So therefore, in specialty hospital, they have the focus in terms of treating a patient. Meanwhile, on general hospitals, if you're a patient, you can go into the general hospital. But if you look a certain specialty based on your disease, you can go into specialty hospitals. So that are the two classifications of hospitals. So in general hospitals, meron tayo dito sa Pilipinas na tinatawag nating PGH or also known as Philippine General Hospitals. This is one of the most common hospital in Manila. Aside from PGH, we also have BGH or Baguio General Hospitals and CGH, Cebu General Hospital, and last but not the least is the DGH or Davao General Hospital or also known as Davao Medical Center nowadays. So those are the different examples under general hospitals. Meanwhile, in specialty hospitals, again, once we said specialty hospitals, they focus us into one type of disease or one part of the body. So these are the PHC or Philippine Heart Center. So whatever diseases that falls into your heart, chronic diseases, they can cater this kind of diseases. Pero pwede din naman sila sa general hospital. Yun nga lang, mas special yung mga procedures sometimes in terms of specialty hospitals. The next one is NKTI or National Kidney Transplant Institute. So they focuses into the different kinds of diseases that happens into the kidney of the person. Or kung may tatanggaling kidney, pwede sila dito sa specialty hospital na to. But then again, pwede din naman sila sa general. Wala namang masama doon. The difference lang is, ang specialty, they focus into one part of your body. And last but not the least, under the specialty hospitals is the LCP or Lung Center of the Philippines, which focuses into the lung of the patients, like treating pneumonia, lung diseases, like tuberculosis and lung cancer, so on and so forth. So that is the difference between general hospitals and specialty hospitals. Aside from hospital, the second type of healthcare facility is the extended healthcare facility. It defined as healthcare facility or it is a place that provide treatment, care, and residential services. So what do we mean by this one? Actually, this kind of facility needs residential services. Once we said residential services, the patient must be reside or doon titira yung pasyente in long period of time. Bakit? Because the treatment is not programmed for short period of time. So therefore, kinakailangan niya doon tumira. So ano pinagkaiba nito doon sa nako-confine? Actually kasi, the difference between that one is yung nako-confine, pwede silang ma-discharge agad-agad. Depende sa cases nila. But then, into healthcare, extended healthcare facilities, doon talaga titira sila until sila ma-cure. So, merong mga ganong hospitals na talagang doon sila tumitira yung pasyente para i-treat ng mga doctors. One of the best example of the extended healthcare facilities is yung mental hospital. So, therefore, dito, kinakailangan mamalagi ng pasyente habang dumadaan siya or nag-undergo siya into the procedures of treatment because the treatment is not programmed for a short period of time. So, ganoon yung extended. Kaya nga siya tinawag na extended, pang matagalan yung treatment. And the patient must reside or kinakailangan tumira doon sa facility nila to treat. Aside from mental health or mental hospital, pwede din maklasify or pumasok dito yung mga home for the aged, 'di ba? Yung mga matatanda na hindi na sometimes kayang alagaan ng kanilang pamilya, they can reside or they can have this kind of facility na doon titira yung mga matatanda at doon naalagaan. So that is extended health care. Aside from extended health care, we also have health center, which is the health center or healthcare facilities which cater to a specific population. So therefore, dito, they focuses into the barangays, they focuses into the specific population because not all of the people in barangay can afford private hospitals. So therefore, dito papasok din yung mga sometimes na free vaccines, free medical check-ups, so on and so forth. It is a mandatory that in each barangay we should have health center to cater the problems in terms of health services. So therefore, health center is very prominent doon sa mga bara-barangay. And last but not the least is the walk-in surgery center. In walk-in surgery center, these are the healthcare facilities that offer surgery without admission. It means ooperahan yung pasyente pero after the operation, he or she can go home without admission. So hindi na siya doon i-confine, hindi na siya doon ma-admit. Sir, pwede ba yon? Yes, pwede yon. So dito papasok yung mga operation like dental. Yan. So, di ba, kapag binunot yung ngipin natin, hindi naman i-confine pa tayo. So, that is walk-in surgery center. Or sometimes, sa mga lalaki, yung tuli. Wala namang masyadong nako-confine or may na-confine ba after natulian yung lalaki or circumcision. So, that is walk-in surgery center. After your operation, you are free to go home and you will not admit into their facilities. So that is walk-in surgery center. So again, let's have some review with regards to the healthcare facilities. So once we said healthcare facilities, these are the places or institutions that offer health services, which I already mentioned a while ago. The different types of healthcare facilities are the hospitals, which has three kinds. So ano-ano yung three kinds na yun? Public, private, and voluntary. And hospitals consist of two classifications which serves as the general and specialty. So after the hospitals, we also have walk-in surgery centers. These are the healthcare facilities na yung patient pwede na agad umuwi after the operation. And health center, nakafocus sila into the barangays and the different kinds of population into the community. And last but not the least, the extended healthcare facilities are the different facilities na kinakailangan mamalagi yung pasyente sa mahabang panahon because the treatment is programmed for long period of time. So again, that is the healthcare facilities. Let's continue with the hospitals or patients in hospitals. Of course, if there's a hospitals, there's a patient also. So there are two kinds of patients, which named as inpatient and outpatient. So what is the difference between the two? The ones we said inpatients, these are the patients who need assistance coming from the health professionals like doctors, nurses, so on and so forth, and must stay inside. That is the key term. The patient must stay inside the hospital to receive proper treatment. So therefore, kinakailangan doon mamalagi ng pasyente for the monitoring, for the procedure, for the treatment, so on and so forth. So it depends until he will be cured on his or her disease. So that is inpatient. The patient must reside or must be a resident into the hospital or inside the hospital. On the other hand, once we said outpatients, these are the patients who needs treatment but does not require the individual to stay inside the hospital. It means after the treatment, you can go home. You can do home medicine or home remedies. So, dun ka na lang sa inyo. So, that is outpatient. So, these are the different kinds of patient into the hospitals. So again, that will serve as a discussion for this day. Thank you and have a nice day ahead.